More than half of Alabama's counties are considered rural, and at least 7 hospitals in those areas have shut their doors in the last 10 years.
Patients in these communities face shortages for primary care, mental health care, and dental care. Despite those shortages, the demand for those services is still strong. In a CBS 42 News special report, Ariana Garza explains how telehealth and urgent care clinics can mean the difference between life and death in some cases for rural Alabamians.
Telehealth is not only convenient, it can also save you money in the long run. According to U.S. News and World Report, a telehealth visit costs about $45 when an in-person visit costs about $125. Now, if you do prefer that in-person care, some urgent care clinics are expanding their services and bringing them straight to you.
Research from the state's public health department shows that patients in rural communities are typically older, meaning they need more medical care, but they also have less income, making it hard to travel to places like Birmingham for specialized or even primary care.
So are you having any belly pain?
No.
Any shortness of breath?
No.
All right, we'll go ahead with the physical exam, okay?
Dr. Eric Wallace with UAB is working to expand telehealth services across the state.
This is a touchscreen.
The service enables doctors to perform checkups on their patients where they live without having to leave where they work.
So if a patient has a stroke in Alabama, they are more likely to die here than any other place on the country.
Dr. Wallace tells CBS 42 that one reason the stroke mortality rate is so high in Alabama is geography. Many patients live more than an hour away from the nearest neurologist, meaning they lose precious time traveling for the treatment they need immediately. That's where telehealth comes in. We
started in Demopolis, Alabama, part of the stroke belt, and now our time to get a neurologist on the screen is less than 5 minutes. So it goes from having to drive 90 minutes to within 5 minutes, I have a neurologist that's evaluating you.
UAB has partnered with the Alabama Department of Public Health to add more of these telehealth carts around the state.
I think we're well on the path that within the next 3 to 5 years, every single subspecialty at UAB will have a clinic in a remote area, and everyone will have access to the care they need to be healthier.
Betsy Stewart with Main Street Family Care tells CBS 42 the company is on a mission to bring in-person care back to rural Alabama, with 16 locations scattered across the state from Aniana down to Mobile.
There are some counties in Alabama that have 0 physicians for the entire county. We were really shocked by that, and as we started opening urgent care areas in rural places, we found a lot of them were they were already driving an hour into Birmingham or an hour into Huntsville to get that after-hours care or get that care on weekends.
Main Street's urgent care services recently expanded to include primary care. The company is also exploring telemedicine, partnering with a new program called Dr. Wellington.
$49 a month covers your labs, your basic procedures, your stitches, your x-rays, and all the visits you're going to need. And so what's cool about this is it's also telemedicine. And so you can come into the clinic to get your health care, but you can also use the telemedicine option.
All you need for Dr. Wellington's telemedicine program is an internet connection and a computer or smartphone to video chat or exchange instant messages with your provider. It's expected to launch in August. The Alabama Department of Public Health already has telehealth carts available at 55 county health departments. 10 more will get them in the coming months. Ariana Garza, CBS 42 News, local coverage you can count on.